Vizag. स्टार्ट हो गया?
Good morning. Today's journal club presentation is on the article A Comprehensive Review on Loops in Orthodontics, which was published in Journal of Orthodontics and Dentofacial Research in 2021. So orthodontic cases can be treated by non-extraction or extraction approach. In case of extraction approach, space closure can be done by group A anchorage, in which anterior retraction is done by 75% and 25% posterior protraction. Group B anchorage, in which 50-50% of space is closed by anterior retraction and posterior protraction. And group C, in which 75% of posterior protraction occurs. Now, the space closure can be done by friction or sliding mechanics or frictionless or loop mechanics. The various methods in friction or sliding mechanic is using a power arm, coil spring, or active lace back, in which the moment is produced by the friction between the wire bracket. And second is frictionless or loop mechanic are used. Spring provides required M/F ratio in loss due to friction, and these are more predictable and versatile mechanics. Then three phases of loop mechanics. Now the space closure and loop mechanics, it occurs in three phases similar to sliding mechanic. First is tipping, then is translation, and then the root movement occurs. But the advantages of loop mechanics over sliding mechanic is that greater activation range is there, and a more constant force, movement, and M/F ratio can be maintained to a constant center of rotation. Now, what is M/F ratio? Controlled root position during movement requires both force and both force move the tooth and a couple to produce the necessary counterbalancing movement. Types of force is dictated the M/F ratio. Now, if M/F ratio for control tipping, the M/F ratio that is required is 7:1. 10:1, and for root movement 12:1 M/F ratio is required. So to obtain a higher M/F ratio, many start increasing the length of the loop, vertical length of the loop, increasing the amount of wire in the gingival portion as in T loop. Load deflection rate, it represents the rate of force decay. Low load deflection rate is important in a spring since it enables the orthodontist to deliver optimal magnitude of force for large activation. Now, the aim of this review article was to explain about the various loops used widely in orthodontics, including ideal dimension, activation, and studies conducted using the loops. Materials and methods via Google Scholar, PubMed, and dental associations of different countries, website, keyword loops and frictionless mechanics. Components of loop, it contains a horizontal force system, a vertical force system, alpha bend, the anterior bend, beta bend, and a helical component. Now, classification of loops, it can be classified based on the configuration. Horizontal loop, example, horizontal loop or boot loop. Vertical loop, combination loop, in which both horizontal and vertical component is there. Based on purpose of the loop, loops are made for leveling and alignment, for retraction, and multi-purpose. Then based on the presence of helix, loops without helix, example is vertical loop, and loops with helix, example helical bulbous loop. Then based on function, opening loop, in which the activation is done by opening the loop, and closing loop, in which activation is done by closing the loop. Now, biomechanical properties of loops. Ideal loop should have a large range of action. It should allow large allowable working load and a low load deflection rate. Parameters improving the biomechanical properties is by increasing the height of the loop, additional wire at the apex of the loop, and angulating loop base to apex, which improves the M/F ratio. Now, biomechanical alpha and beta ends. Offset altering the movements generating at the alpha and the beta ends. Distance is less. then off-centering of the loop will affect the movement significantly. Thus, this distance is an important consideration for biomechanical properties of loop. Now, the various loops used in contemporary orthodontics. First, this is vertical. It was introduced by Robert Stank in 1933. It is constructed with 016 SSY mm. Vertical loops can be closing or opening and can be used for closing spaces and rotating teeth. Now, Burston described the force system of vertical loop in retraction mechanics. Vertical height of 6 mm is a typical clinical application as it delivers a force deflection rate of 437 gram per mm and moment to force ratio to 2.2 mm. So, in Begg's mechanics, anterior tooth alignment is accomplished with arch wires incorporated with vertical loops. The loops increase the wire span between the teeth and produce a gentler pressure during movement. Now, opening and closing vertical loops. This first one is closing vertical loop, which is activated by compressing the legs. As the loop expends its force, it draws the horizontal components of the arch wire together and moves the attached teeth with them. So this is the passive wire. When it is engaged, this will reduce the distance. The space closure will occur. Then second is the opening vertical loop. Now the arch wire is fixed to brackets. The loop is activated by compressing the legs. And as the loop returns to its original position, the tooth moves apart. Now, modifications of vertical loop. First is double vertical loop used for labiolingual movement and rotation correction. Then omega loop, which gives bodily thrust to the last tooth in the arch. Omega loop is a modification. Horizontal loop used for bite opening and easier bracket engagement. Double horizontal loop used for tipping and root movement. And box loop, a combination of horizontal and vertical loop. Then second is bull loop. The bull loop was given by Harry L. Bull in 1951. A sectional steel arch wire made of 21525 was used to retract the anteriors. Then upper bull loop, the dimension of the upper bull loop is height is 7 mm. Wire distal to the loop is 18 mm. Wire mesial to the loop is 22 mm. And for lower, height is 5 mm. Wire distal to the loop is 20 mm. And wire mesial to the loop is 28 mm. So activation of the bull loop, a closed loop in the region of extraction site of the first cuspid is activated to open by a millimeter after tying the arches in. Next, bull loop can be used for class 2 elastics. Dr. William Houghton modified the maxillary sectional arch by adding a small loop distal to the closing loops for engaging the anterior end of the class 2 elastics. Advantage, these do not procline the mandibular anterior since the closing loop restrain this effect. Then second is horizontal. Boot loop was described by Morris M. Stoner in 1960. Is for flex parallel to the arch wire. Incorporating a horizontal loop allows greater control over the direction of the force. The horizontal loop's principal value is its reduction force in the vertical plane or occlusal gingival direction, permitting immediate bracket engagement in severely positioned teeth, which the operator may want to elevate or depress. It is effective. Activation produces occlusal gingival movement. The elastic teeth on one side of the loop while extruding them on the other side. The posterior extension of the horizontal loop, which extends to become buccal portion of the arch wire, is fashioned occlusally. Portion is placed occlusally, whereas the anterior extension is fashioned gingivally. This will cause intrusion of the anteriors and extrusion of the posteriors. Next is omega loop. A variation of the open vertical loop was described by Morris M. Stoner in 1960. It was called so due to its resemblance to the Greek letter omega, after which it is named. Its advantage over the open vertical loop lies in its lesser fracture tendency owing to a more even stress distribution through the curvature of the loop rather than its concentration at the apex. It is commonly used for bodily movement of the root and as a molar stop. Modification of omega loop for midline diastema closure. It was given by Gandhi et al. By placing two crimpable hooks diametrically opposite to each other, and each end stretched between the hooks provided the activating force to close the midline diastema. Then T loop. This loop was given by Dr. Charles J. Burston in 1962. According to Burston, TMA wires should be used in construction of T loop. Additional wires should be placed as far apically as possible to increase the activation moment to force ratio, and the loop centricity in the alpha and beta positions affects the rate of change of the moment to force ratio. So during T-loop activation, two forces are applied. Horizontal force, it is the forces applied for the retraction of the canine. Three retraction spring is activated by pulling the distal end of the spring through the molar tube and cinching it back. The distal forces acting on the anterior teeth always equal to the mesial forces acting on the posterior. And vertical forces, these are intrusive or extrusive forces acting on the anterior and posterior teeth. So both retraction and intrusion and extrusion can be done by generated from unequal alpha and beta moments. So if in a centered bend, if the alpha and the beta moment are equal with the loop centered, no vertical force is generated. If alpha moment is greater, if the bend is greater than the alpha beta moment, anchorage is enhanced in the anchorage segment, anterior segment. So net extrusive force on the anterior segment. If beta moment is greater than the alpha moment, anchorage is enhanced in the posterior segment. So the side in which the movement is greater, that side acts as the anchorage unit, and the movement of the opposite side occurs. So T-loop, this is the dimension of the segmental T-loop, and this is the dimension for T-loop in the continuous arch. T-loop pre-activation bends. T-loop six pre-activation bends are given in the T-loop. These spring have horizontal loop of 10 mm and vertical height of 7 mm. So first pre-activation bend is 40° at the end of the gingival length. Then mesial length, the mesial alpha leg is angulated at an angle of 15°, and the distal leg have a gradual curve of 30. First a 12° bend is given, and then it is gradually curved to 30°. So this is the template for T-loop conformation, which was given by Hoening et al. Asymmetric T-loop was described by James Hilger in 1992. This loop allows simultaneous it is made of 1622 TMA or 1925 TMA wire with 5 mm vertical step, 2 mm anterior loop, a 5 mm posterior loop, and exaggerated reverse curve of speed. Activation of asymmetric T loop is done by compressing the short mesial loop and opening the long distal loop. Then double keyhole loop. John Parker of Armenda, California, introduced double keyhole loop in Roth treatment mechanics. 1925 rectangular SS arch wire is used for fabrication of DKL. This loop resembles a champagne bottle, which is mixed vertical and horizontal loop. So DKL consists of two symmetrical loops placed bilaterally near canines that resemble key eyelets. Height of the loop is 7 mm, and the distance between two loops of the same side is approximately 8 mm. So the requisites for installation of DKL, the anterior sector should be diastema free and consolidated with ligature wire to maintain the close proximal contact. Well aligned dental arches with previous arch wire sequence fully expressing torque on each tooth, and dimension of DKL must be similar to previous rectangular arch wire to allow easy insertion and perfect sliding of the arch and slots of the braces. Activation can be done arch as a spring. This activation can be done in two ways. First is activation by distal traction of the arch by pulling the arch wire for opening the loops from behind the molar tube for activation. Activation of loops should not be more than 1 mm. Second is activation with retro ligature. A ligature wire tied in between hook of the molar tube and the distal loop of the DKL. Then next is Ricketts canine retraction spring, Ricketts arm. It is usually fabricated to SS wire of 70 mm length. It produces a canine retraction of a millimeter. An activation of 3 to 4 mm is required for individual canine. Next is Opus loop. Opus loop was given by Raymond E. Sitowski in 1977. Opus loop is capable of delivering M by F within range of 8 to 9.1 mm. Dimensions 10 mm height, 10 mm length, and 0.5 mm radius. 1622-inch SS wire, 1825-inch SS wire, and 1725-inch TMA wire. He designed this the range of 8 to 9 mm inherently without adding residual movements by twist or bends anywhere in the arch wire or loop before insertion. So inherent MF ratio was of 8.9 mm was designed. And if a closing loop design capable of achieving inherent constant MF of 8 to 9 mm without residual movement were available, mass space closure within uniform periodontal ligament stress distribution could be achieved. Less demand for operators on operator skill and might provide rapid tooth movement with less traumatic side effects. Then next is PG retraction spring was introduced in 1985 by Paul Jessing. The resultant spring design made from 1622-inch stainless steel wire. The predominant active element is the 10 apically. The spring is constructed to resist rotational and tipping tendencies during retraction, not to correct rotations or extreme deviations in inclination of the canine. Therefore, leveling of the buccal segment must be terminated prior to insertion of the spring. So this is how a PG spring is, retraction spring is activated. Activation to 140 to 160 gram is obtained by pulling distal to the molar tube until the two sections of the double helix are separated by 1 and is repeated every 4 weeks. Next is K-loop. In 1995, Dr. Varun Kalra introduced K molar distalization in class 2 malocclusion. So K-loop was fabricated for molar distalization. It has the ability to move the maxillary molars distally with total bodily control. The appliance consists of a K-loop to provide the forces and movements and a Nance button for anchorage. It is made of 1725 TMA wire with each loop 8 long and 1.5 wide. Wire is marked mesial to the molar tube, distal of premolar bracket, and bend is placed 1 distal to the distal mark and 1 mesial to the mesial mark. So that is the K loop for molar distalization. So stop should be well defined and about 1.5 long. It is placed with 2 activation. Now next is hand retraction, which was developed by Dr. Varun Kalra. Width is fabricated with 1925 TMA arch wire at the sites of extraction. So how is it fabricated? A 90-degree centered V-bend is placed at the level of each U-loop. Then first 90-degree centered V-bend is given. Then 60-degree V-bend located off-centered with the shorter arm near the molar tube, producing an increased clockwise movement on the first molar, thereby augmenting posterior anchorage. So the shorter arm is towards the MF ratio will be produced in the posterior molar region as the anchorage unit. Then a 20-degree anti-rotation bend is used to counter the mesolingual rotation of the buccal segment. So what are the advantages of Kaiser loop? First, simplicity in design and fabrication, comfort to the patient and less chances of tissue impingement. As it can en masse retraction, it abbreviates orthodontic treatment time compared to conventional edgewise mechanics, and this prevents the appearance of an unsightly space distal to the laterals, which is seen in retraction. Next is rectangular loop. The rectangular loop was described by Dr. Vittorio Cassia Festa. Is a versatile loop which can be used for first order, second order, and third order corrections. It is made of TMA 1725, and this loop is the most effective in correcting single tooth discrepancies in all planes of space. The next is mushroom loop. Prefabricated mushroom loop arch wires 2003. This loop arch wire produces an ideal movement to neither is there any interference of the loop with the gingival tissue, nor does it distort readily, thereby improving the delivery of the orthodontic load. 1725 beta 3 Connecticut new arch wire is used. So preformed mushroom loop wires are fabricated. Pre-activation of 3 separation between the legs is done anteriorly along with anchorage reinforcement is necessary. Reactivation of the loop is not done until a closure of 3 of space is there, thus ensuring a constant movement to force ratio is maintained. Snail loop, this was given by Dr. Pavan Kumar Vibhuti in 2004. Snail loop is spiral shaped and designed for en masse space closure of the anterior teeth. The snail loop is fashioned from 1725 stainless steel wire by bending a simple omega loop into movements. The outer portion of the snail loop is 8 high and 3 wide. Then next is double delta loop. It serves to close spaces used for leveling and integration of the arches. So double delta loop is fabricated. Next is teardrop loop. The ideal force applied to achieve movement of the mandibular incisors is approximately 2.60 Newton. The teardrop loop of 8 height, which was activated 1 provided 2.77 Newton force. So it can be used for lower anterior retraction. The next is shoehorn loop. Shoehorn loop has been described by Tweed Merrifield appliance. The height of the loop is 8 It consists of long and a short vertical loop. And cherry loop. It was given by Peretta Redento in 2002. It is constructed with 1725 SS wire, a large diameter round loop of 8 mm width. Height of the loop is 8 to 9 mm, opens 3 to 4 mm at occlusal end to avoid stress and deformation. Cherry loop is used in molar protraction where it is placed one half the distance. So it is used for molar protraction. Now the loop is activated in two phases. So this is the picture showing the activation of the cherry loop for protraction of the molar. Now these are various studies which were and references results were given according to the various studies. Now, so the conclusion which was made in the article was 6 goals to be considered for any universal method of space closure include differential space closure, the capability of anterior retraction, posterior protraction, or a combination of both should be possible. Minimum patient cooperation. This is achieved by eliminating the usage of headgears and elastics, axial inclination control, control of rotations and arch width, optimum biologic response, tissue damage, particularly root resorption, should also be at a minimum, and operative convenience. The mechanism should be relatively simple to use, requiring only a few adjustments for the complication of space closure. These are the references.